Of all the lessons from the COVID crisis, I want to leave you with just one big one. Now listen, we were all scared to death at the beginning of this thing. Remember watching New York City? I mean, New York is the hub of media and publicity for the world. We all witnessed 24 hours a day the incredible increase in cases and deaths that happened in the city, and we all wondered, is this coming to my town? Dr. Fauci and all of his staff, same thing early on. They were so afraid this was going to overwhelm the hospitals. That was the big issue. I mean, what if we didn't have enough beds, enough doctors, enough ventilators? And so that's what public policy was based on. You know, Trump sent that ship up that had been converted to a hospital. A doctor friend of mine told me that in his hospital, they always had about 70 to 80% occupancy in their beds just to pay the bills. He said they reduced that to 40% if it wasn't a non-essential procedure to get ready for this big coming of COVID patients. I remember the 15 days to slow the spread in March. That was strictly to keep us out of hospitals. At the end of that 15 days, and by the way, another lesson I learned there was that that didn't work. All that the government did didn't work. Typical government fashion, they doubled down on that. Kind of like the ventilators. Do you realize a lot of people died because of the ventilators? I'd love to know, number-wise, just how many people would be alive today if they've never been put on a ventilator. But let's get to the bigger lesson. I started an Excel spreadsheet after the 15 days to slow the spread. And the CDC gave me two numbers, number of new cases per day, number of deaths per day. I tracked these two columns for over a year. But here's the big lesson. Somewhere along the way, Dr. Fauci, the CDC, the FDA, and the rest, all the officials who were responsible for public policy, they knew, 100% knew, that this COVID virus did not have the power to overtake the hospitals. Now listen, all their dumb policy, I forgive them when they didn't know. But once they knew, here's the lesson. They chose not to tell us the truth. Instead, to stoke fear. That was their goal. And then they had partners, the press, social media, Wall Street companies, including pharmaceuticals, who knew they were going to make billions off this virus. This whole group teamed together to stoke the fear. They wanted every American to believe that 24 hours a day they could catch this virus, go to the hospital, and die. You know what? The one number, the one column I didn't have in my spreadsheet? Hospitalizations. CDC didn't give that. I look back at that spreadsheet now and it just pains me because, really, if you're going to do public policy, the only number that mattered for public policy is hospitalizations. Because, again, the big fear was that the hospitals would be overrun. But if they reveal that number, it appears to me, then we would have known the truth. Listen, I believe that some reporters should investigate, go through correspondences of all these Fauci and others, any reference they find to stoking fear and not telling the truth, not giving all the information. Every one of those people should be fired. But at a minimum, please do not miss this lesson.